Neck pain, including neck tension, tightness, and stiffness, is common in athletes and those involved in weight training. Yet everyone, even those not involved in physical training, experience this condition at some point. Athletes and weightlifters experience stiff neck and neck pain during or after exercises that involve the shoulder and upper back. For example, shoulder shrugs, lateral raises, deadlifts, bench press, pull-ups, and squats. It's something I struggled with. It's frustrating, painful, and demoralizing. I fixed my neck pain and I will show you how to do the same. Hello. This is Nuruddin. In this video, I will show you step by step how to get rid of tension, tightness, and stiffness in the neck so you can lift and work out without neck pain. For reference, here's a timestamp of this video. This is a two-part video. In this explainer video, you will learn everything you need to know about neck pain, what causes it, why it happens, and the fastest way to fix it. The second video is a 5 to 10 minute treatment video where I show you step-by-step exercises to treat and get rid of neck pain and stiff neck. Before we begin, a quick medical disclaimer. I'm a personal trainer, nutritionist, physique athlete, and wellness coach. I've been lifting for 10 years. I transformed my body, but in the process, I experienced and struggled with several weightlifting injuries, including muscle injury pain and tendonitis. I was frustrated and fed up with the generic advice I was receiving from the professionals I consulted with, such as ice and rest it, painkillers, and physical therapy. So I set out to solve this issue for myself. What I discovered worked so well for me. I've synthesized everything I've learned in over 5 years of research on this topic, and that's what I will be sharing with you. So this video is for informational purposes only. It is not medical advice. Neck pain can be a sign of a serious medical condition. It's always a good idea to consult with your doctor to make sure there is no structural damage to the neck. With that said, let's begin. What causes stiff neck and neck pain? Neck pain, including tension, tightness, and stiffness in the neck, can be the result of many things, including sudden impact to the neck, such as a car accident, lifestyle factors, such as a person's occupation, sleeping position, sleeping pillow, chronic stress, tension in the body, and bad posture. While these factors can contribute to neck pain, this video will focus on the root causes of stiff neck and neck pain when lifting weight. There are 3 root causes: muscle restriction, subluxation, and chronic inflammation. Muscle restriction. When you lift weights and perform exercises that target or involve the shoulder and back, the upper back and posterior neck muscles, specifically the levator scapulae, trapezius, rhomboids, serratus posterior, and erector muscles contract, become stiff and tight, and after some time lose their elasticity. Muscle restriction occurs when inelastic muscle fibers become shortened and unable to release and lengthen back to their normal relaxed state. In the case of a stiff neck condition, lifting a weight that's too heavy or using bad weightlifting form overstretch and cause the upper back and posterior neck muscles to become restricted. This is usually the trigger that causes a stiff neck condition. When the levator scapulae, trapezius, rhomboids, serratus posterior, and erector muscles at the back of the neck get restricted, they become shortened and get tighter, which leads to tension in the neck and shoulders. This tension causes the neck to feel tight when lifting or after lifting weights. Additionally, tight muscles in the upper back and posterior neck pull and put tension on the cervical spine. Over time, this can trigger a condition known as subluxation. Subluxation. Restricted muscles pull tighter on the joints. Over time, this condition causes the joints to move out of their normal position. This condition is known as subluxation, and it can affect the joints and the nervous system in the body. In the case of neck pain, restricted muscles at the back of the neck pull pull on the vertebrae in the cervical spine. Over time, this causes the vertebrae to move out of their normal position, which causes neck pain. Misaligned vertebrae also stretch and choke the nerves, leading to sharp nerve pain in the neck. Finally, misaligned vertebrae inflame ligaments and the spinal disc in the cervical spine, which creates excessive inflammation that lead to further pain. When this condition continues for 3 months, it becomes a chronic inflammatory condition or chronic neck pain, chronic inflammation. So far, we've discussed how muscle restriction and subluxation cause inflammation of muscles, vertebrae, and the cervical spine. In the case of dull or sharp neck pain, when the injury first occurs, the inflammation is acute, meaning the pain and condition are temporary. With time, the body heals muscle strain and subluxation in the cervical spine and the pain goes away. However, when restricted muscles and subluxation in the vertical spine cannot heal and recover, and the pain continues for 3 months or more, it becomes a chronic inflammatory condition. Chronic inflammation is a state where the inflammatory process that enables the body to heal injured muscle, tendon, and ligament is not working, and the body is no longer able to heal on its own. In this case, it leads to chronic neck pain. Left untreated, chronic inflammation in the cervical spine becomes degenerative and leads to irreversible deterioration of the spine. To summarize, the causes of tension, tightness, and stiffness in the neck when lifting or after lifting weights are restricted upper back and posterior neck muscles. The causes of dull or sharp neck pain are 1. Muscle pain caused by tense and restricted upper back and neck muscles. 2. Subluxation caused by tight muscles that pull on the cervical vertebrae, moving them out of their normal position. 3. Inflammatory pain caused by strain and inflammation of muscle, ligaments, and vertebrae in the neck. Overview: common neck pain related conditions and how to fix it. There are 2 types of neck pain related conditions people experience during exercise or after lifting weights. The first type is tension, tightness, and stiffness in the neck that does not cause pain but limits range of motion when turning the head side to side. The second type is sharp and sudden neck pain that limits mobility of the head and neck. To fix tension and stiffness in the neck, we need to do 2 things. 1. Release restricted upper back and posterior neck muscles to improve muscle pliability. If a person experiences tightness and stiffness in the neck after lifting, this will provide relief and help fix it. 2. Supplement with magnesium to replenish muscle magnesium levels in the body. Magnesium helps muscles relax. When the body is magnesium deficient, muscles become tight and stay tight. To fix sharp and sudden neck pain, we need to do 3 things. 1. Reduce chronic inflammation to heal muscle strain, inflamed tendons, and ligaments causing pain in the neck. 2. Fix subluxation in the cervical spine to correct misaligned vertebrae and release pressure on the spinal disc and nerves. If a person experiences sharp and sudden neck pain, this will help fix it. 3. Release restricted upper back and neck muscles. As I mentioned earlier, this will improve muscle pliability and alleviate tension in the neck, shoulder, and upper back. Neck pain can be complicated, especially if it's chronic and has been going on for many years. However, implementing the aforementioned can eliminate or significantly reduce pain, improve mobility, and provide ongoing relief from tension and stiffness in the neck. I cover how to reduce chronic inflammation using a plant-based diet and magnesium therapy in the TitaniumPhysique Step 1 and step 3 videos. So in the rest of this video, I'll focus on how to release restricted upper back and posterior neck muscles and the best way to fix subluxation in the neck, the number one cause of stiff neck and neck pain. Before we discuss how to release the muscles that cause stiff neck and neck pain, let's discuss one of the root causes of neck pain: the sleeping pillow. Whether you are a side sleeper, back sleeper, or stomach sleeper, using a bad sleeping pillow can put unnecessary strain on the shoulder, upper back, and neck and cause tension and pain in the neck. For example, if a person often wakes up with muscle strain in their neck and the muscle strain gets better throughout the day, this is a sign that person is using a harmful sleeping pillow. A good sleeping pillow should absorb and reduce the pressure on your head when you lie down. It should fit the neck cervical and it should support the alignment of your spine regardless of your sleeping position. Unfortunately, traditional pillows cannot do this. To counteract and prevent neck pain, including neck tension, tightness, and stiffness, it's vital to use a good sleeping pillow. Without a good sleeping pillow, the neck will get strained during sleep. Using a good sleeping pillow is one of the easiest things you can do to avoid neck pain. I've experimented with dozens of sleeping pillows. The Star cervical memory foam pillow is what I use. It is an excellent sleeping pillow. If you'd like to check it out, you can find a link to it in the menu section of the members dashboard or mobile app. How to fix tension, tightness, and stiffness in the neck. To fix and get rid of a stiff neck condition, we need to release restricted upper back and posterior neck muscles. Specifically, we need to target and release the levator scapulae, trapezius, rhomboids, and the spinal erectors. When this collective group of muscles become restricted, they get tight and cause tension and stiffness in the neck. How to fix sharp and sudden neck pain. Sharp and sudden neck pain is caused by a combination of muscle restriction and subluxation. Chronically restricted muscles in the upper back and neck become overstretched. As a result, they pull on the cervical vertebrae, leading to pain in the neck. If the pain is sharp and it restricts the mobility of your head, the first thing to do is find a chiropractor to adjust and correct subluxation. You can find a local chiropractor in your area by searching your favorite search engine. I prefer Gonstead chiropractors. I like their approach to spine health and I've had great results with their approach. From my experience with Gonstead chiropractors, first, they do an x-ray of your spine. Then they use a special tool to read the nerve endings along the spine to find subluxation. Then they adjust that specific vertebra. Whichever chiropractor you choose, I suggest the type that would first do an x-ray of your spine, if possible, before any adjustments. In my experience, this initial analysis can help prevent further complications. Most people will need 2 to 3 chiropractic adjustments to correct and fix a cervical subluxation, but this depends on your specific situation. The chiropractor can help you determine how often you need to get adjusted based on their assessments. Once the sharp pain in the neck is gone and you can move your head without pain, at that point, you can begin releasing the upper back and posterior neck muscles to prevent future relapse of subluxation in the cervical spine. Releasing the upper back and posterior neck muscles is simple to do, and even better, you can do it all in the comfort of your home. I've got a video that will show you step by step how to do it. We'll discuss that video in just a moment. The fastest and easiest way to correct restricted muscles and relieve neck pain. In this part of the video, I'd like to discuss the best method to release the collective group of muscles we just discussed. This group of muscles include the levator scapulae, trapezius, rhomboids, serratus posterior, and spinal erectors. There are 3 general options to release these muscles: massage therapy or other forms of manual therapy, vibrating massagers, and physical therapy, which includes stretching and mobility. Massage therapy. Massage therapy is effective for treating pain caused by injured muscle, such as stiff neck and neck pain. However, it's necessary to get multiple massage treatments over an extended time, which can be expensive, making this solution impractical for most people. In addition, most people don't like the intense pain during a therapeutic deep tissue massage. Some people tense up during this type of treatment, which makes it counterproductive. Ultimately, the reason I do not recommend massage therapy or other forms of manual therapy is to fix chronic tension, tightness, and stiffness in the neck, as well as counteract and prevent neck pain. It's necessary to treat the upper back and posterior neck muscles often. So unless someone has the resources to see a manual therapist 2 to 3 times a week indefinitely, this solution is not sustainable. Vibrating massagers. When you apply vigorous vibration to a chronically stiff and tight muscle, it can trigger the muscle to tense up and get tighter. This is because the muscle is inelastic and cannot absorb the shock of the vibration. Most people find that their neck, shoulders, and upper back muscles get tense and tighter after using a vibrating massager. For this reason, I don't use vibrating massagers and do not recommend them when treating chronically tight muscles. Physical therapy, stretching, and mobility. Stretching will help lengthen a muscle and it helps reduce muscle pain and joint pain. However, stretching a chronically tight muscle will not lengthen the muscle and alleviate pain. Before you can lengthen the muscle, first, it's necessary to release the restricted muscle. Then you can stretch the muscle to lengthen it and alleviate pain. So physical therapy, including stretching and mobility, are important, but they are not the solution. So what is the best method? Self-myofascial release tools. Self-myofascial release tools, aka SMR tools. The fastest and easiest way to fix tightness, stiffness, and tension in the neck is to use myofascial release tools. Here are 4 reasons I use and recommend them. 1. They are generally inexpensive, so cost is not an issue. 2. They are effective with trigger point therapy. Trigger points are specific areas in a body where muscle often become knotted and cause pain. I will show you how to easily identify those muscles. And because you know and can feel exactly where the tension and pain are at the back of your neck, shoulders, and upper back, you can easily target those trigger points yourself. 3. You can use these tools in the comfort of your home as many times as needed. Additionally, these tools are durable and last many years, so it's a sustainable solution. Finally, because you'll be performing the treatment yourself, you can control the pressure. As such, the body can remain relaxed throughout the treatment for better and faster results. Here is a quick summary. To alleviate tension, tightness, and fix a stiff neck condition, we need to release restricted upper back and posterior neck muscles. The 3 common treatment options are massage therapy, vibrating massages, and physical therapy, which includes stretching and mobility. However, these options are ineffective or unsustainable. The best method and the fastest way to release chronically restricted upper back and posterior neck muscles is to use self-myofascial release tools. Neck pain SMR treatment video. I've created a simple to follow SMR treatment video for neck pain. Myofascial release is a safe and effective technique that involves applying gentle, sustained pressure to a restricted muscle or trigger point to eliminate pain and restore motion. The neck SMR video is a 5 to 10 minute treatment routine where I show you step-by-step exercises to treat and fix neck pain. You can use this treatment routine either at the gym or in the comfort of your home. You will need some SMR tools, specifically a Theracane, Body Star massage ball, and rumble roller. It's important to use the right tools to get results. If a person uses the wrong tools, the results are going to be frustrating and demoralizing. I've tested a lot of these tools to find the best and most effective ones. So if you don't already have these specific tools, make sure you grab them so you'll have them when you're ready to get started. You can find a link to these tools in the menu section of the members dashboard or the mobile app. Neck pain treatment versus prevention. In this part of the video, I'd like to discuss the difference between treatment versus prevention for neck pain. To treat and prevent neck pain, we must do two things. One, keep the spine healthy, and two, keep the upper back and posterior neck muscles pliable. First, let's discuss the muscles, then we will talk about the spine. The treatment routine we will be using to release the upper back and posterior neck muscles to fix neck pain is the same routine we will use to prevent neck pain from coming back. The difference between treatment and prevention is how often we apply the routine. For example, to treat a chronic stiff neck condition, we need to work on the upper back and posterior neck muscle every other day. 1 day treatment and the next day rest to allow the muscles to recover. For faster results, you can work on the upper back and posterior neck muscles 2 times a day, once in the morning and then once at night. When you begin to experience increased mobility, turning your head side to side, and less tension around the neck and shoulder, you have effectively released the restricted muscles, causing tightness and stiffness in the neck. From there, we want to maintain the new level of muscle elasticity to prevent the upper back and neck muscles from getting restricted again. For prevention, use the same routine in the treatment video 2 to 3 times a week to counteract and prevent stiff neck and neck pain. Keep in mind, a lot of tension goes into the upper back, shoulders, and neck when we lift weights and exercise. The more you train your upper body and the heavier you lift, the more often you'll have to apply this routine to keep the upper back and posterior neck muscles pliable and healthy. Now, let's discuss spine health treatment versus prevention. As I mentioned earlier, if you experience sharp pain and it restricts the movement of your head, the first thing to do is to find a chiropractor to adjust and correct subluxation in the cervical spine. To correct and fix acute subluxation, most people will need 2 to 3 chiropractic adjustments, but this depends on your specific situation. Your chiropractor can help you determine how often you will need to get adjusted based on their assessments. For prevention, a good way to think of it is the body is always in a state of change. It is either anabolic or catabolic. Anabolic means it's improving and getting better. Catabolic means it's breaking down due to stress, pressure, and lifestyle factors. To keep the spine healthy and prevent neck pain, it's important to have regular checkups with your chiropractor. I see my chiropractor once a month for routine spinal adjustments. In addition to using a good sleeping pillow and applying the routine in the neck treatment video, monthly checkups with your chiropractor will help counteract and prevent stiff neck and neck pain. One final point to keep in mind: muscles support and stabilize the joints. When muscles become tight, the joints adapt to the tightness of the muscle to maintain stability. Likewise, when muscles become more pliable and elastic, the joints must readjust to the new elasticity of the muscle. This means when you start applying the routine in the treatment video and the upper back and posterior neck muscles begin to release, the cervical spine will need to get used to the increased range of motion in the neck. One way to help the cervical spine adapt faster is to perform neck mobility exercises. Mobility exercises improve range of motion, joint stability, and muscle strength by controlling the muscles around the joint. In this case, the spine. In addition to the neck pain treatment video, I've created a simple to follow neck mobility exercise video in a series called power, strength, mobility. It's a 5 to 10 minute video. To summarize, you can use the SMR routine in the neck pain treatment video every other day to treat and alleviate neck pain. On the days where you're not using the treatment routine, you can use the neck power, strength, mobility routine to strengthen and stabilize the cervical spine for faster recovery. When you get to the prevention phase where the neck feels great with increased mobility and less tension and stiffness, use the SMR routine 2 to 3 times a week to keep the upper back and posterior neck muscles pliable and healthy going forward. During the prevention phase, you can also use the neck SMR routine the night before any upper body workout. It's also beneficial to use the neck SMR routine after your upper body workouts, ideally 2 to 3 hours after the workout. This practice will help the upper back and posterior neck muscles recover faster for the next workout. We've covered a lot of information in this video. If any of it is new, some of it might sound confusing like it was for me when I first started to learn some of this. If that's the case, I encourage you to go back and listen to this video or the audio program as many times as necessary. That way you will have the foundational information necessary to fix and counteract neck pain. Once I understood this information and implemented it into my fitness routine, it allowed me to eliminate neck pain and counteract tension, tightness, and stiffness in my neck. To get started, check out the neck pain treatment video in the TitaniumPhysique members dashboard or mobile app. Thanks, and I look forward to seeing you in the next video.